I guess one other thing that comes to mind as we think about where the field is headed in the future is that we've seen some early but promising data for CAR T cell based therapies. This is using the patient's own T lymphocyte cells, educating them outside the body, and then reinfusing them to try to have a sustained response to CLL. And although this is not yet an FDA-approved treatment in CLL, I think it's showing promise. And I think about it for my younger patients, particularly those who have maybe been through a few lines of CLL treatment already, particularly if they have very high-risk disease like the TP53 deletion or mutation. Currently those are patients we think about bone marrow transplant, allogeneic transplantation for, but that certainly has some very serious risks. And so even though CAR T cell therapy also has risks, I think in general, the toxicity profile is more favorable than allogeneic transplantation. We've started to see some patients with very long-term remissions now from CAR T. So I'm excited to see how that field evolves in the coming years. There's people exploring various combinations of different drugs with CAR T. And so I think the technology and the combination therapies will improve over time. And so I do think that for younger patients who have a long time horizon, that could eventually be an approved option to think about down the road.